Thank you, Lori. What a story, what a call to arms, a call to action that you've delivered this morning, and we're so proud to be able to work with you to really help effect change on an issue that too many people have been quiet about for too long. I completely agree with you and admire you immensely and everybody involved in this. So as Lori said, we were delighted to have the opportunity to commission a public opinion survey. We've been commissioning surveys for 25, 28, I think, years actually now, on a whole range of issues having to do with health and with research for health and the keeping a finger, if you will, on the pulse of the American public on what attitudes there are and questions that clearly call for answers and solutions. So this is a glimpse of our data. There's more of it on our website, but it'll just give you a little taste. And we look forward to seeing in a few years' time what may have changed, hopefully for the better. But the news is actually quite positive. This is a little bit about the methodology of the survey, very standard public opinion survey methodology with oversampling of minority groups because we wanted to tease out if differences were there or not and be clear about that. So to start with, you can see that across various groups, that sort of subgroups that were sampled, a very strong level in the high 70s for the most part, on average, saying that child abuse and neglect is a public health problem in the United States. This may be higher than you anticipated you were going to see, and high across, as I said, a number of groups. There is a slight tendency for Asian Americans to discount the level, to not say it's quite as high a level, and that's true throughout this survey work, that we see a little less tendency to say it's a strong problem in Asian Americans, but it's not so strong that we can just say it definitively. It, I would say, needs a little more testing in that regard. But we also decided to take a look at political party preference just to see what differences we might find there. And they're not surprising to us, and I'll mention a few of these as we go along. So this question, I think, is one of the most important ones that we asked, because it's one thing to ask about just one issue at a time. It's another thing to ask people to rank them. So when we ask folks to indicate what they consider top public health concerns, top, this is the finding. And you can see that child abuse and neglect is right up there with other top issues, public health issues. And it's not surprising that you would see drug addiction at the top, given the horrible opioid epidemic that's commanding headlines and taking lives every day, followed by cancer, always near the top or at the top for 25 years. And you can read the rest. But if you don't, sometimes people say, well, I never hear that child abuse and neglect is a top issue, and it's probably because they've never been asked in a list that contains other things that people consider top issues. So this is an extremely important finding. Now, it's one thing to say it in the abstract. It's a problem somewhere in the country. It's another thing to sort of own it in your own community. So here we can see that people either in big percentages agree, strongly agree, or somewhat agree that child abuse and neglect is a problem in their local community. This is also an extremely important finding. And the impact, what about the impact of child abuse and neglect? People see what experts see. People see what those in the professional community see through surveys and in their offices. and listening to stories on their telephones or in their homes, what is linked to child abuse and neglect. And this finding pretty much replicates what's been seen by others in previous studies, although I will say that taking a look at some of those previous studies, obesity and eating disorder link is higher here. I think that's probably because it is more, people are more aware of the problem of obesity and the lives it ultimately takes with the addition of lifelong bad habits paying off in disease that kills people. So this is disturbing finding that people don't think that health professionals are doing a very effective job in intervening, preventing, or stopping abuse and appropriately treating victims. Only, one way of looking at the news here is that only 31%, less than a third, say that health professionals are doing a good job. That's disturbing. There's plenty of room for improvement here, and one would hope in a few years that health professionals would feel more confident about intervening and treating, that there'd be more research that allows them to do so, and more public support for that to happen, including resources, public resources. So then we get to the resources. Who bears the responsibility to end child abuse and neglect here? And there's a range of possibilities. And in this one, we see what we feel are quite predictable differences, especially in party identification as they name whose responsibility it is. So Democrats are, let me get this right. Let me back up to say that Democrats are more likely to say that governments have a role than are Republicans or independents, and it's always in that order. Democrats say, yes, government should do more than Republicans, and then independent at the bottom of the three. And it's also true in this one that Democrats are more likely to say child and family services compared to Republicans and independents. So as I say, those are entirely consistent with party preference on a number of other issues, and it's true in this question as well. The next one is about prevention and treatment, and for that matter, research on causes. Research on all of those areas should be attended to. Very strong support, these levels of support, not a lot of difference among either racial and ethnic groups or political party identification. And again, once you get into saying the government should play a role, you do see differences in political party approval, but they're still high. And I want to emphasize that in the previous statement too. Even though Democrats are more likely to be positive about government support, it's not like it's 30% differences, it's 10%. More or less. So there aren't striking differences. Everything's over 50%. And it's a lot of positive reinforcement to work with, whether that work is done in state capitals, locally, or here in Washington on Capitol Hill in terms of demanding more resources, more research for services, and for improving this problem crying for attention. Public support is with you all, Lori, and everyone, and wants you to succeed. So do we. Thank you.